For joining us today for Prevention Exchange. We are so excited today to have our guest, Julia Donovan, but I'm going to give you a brief welcome and then we're going to hand the reins over to Julia. Today, we are brought to you by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. We have our purpose and our mission here listed for you. Our panelist today is Julia Donovan, and she is the statewide program director for OhioKAN. I'm going to let her give her own introduction and share about her experience, which we were really excited today to talk a bit about caregiver needs. So today we're really hoping to learn more and start to understand the experience and diverse roles of caregivers. So caregiving can mean something different to each of us, often based on our own life experience. So we're going to have a few real life examples, as well as start to learn about the nuance of different caregiving experiences. We're going to understand the unique needs of caregivers and also resources available for caregivers here in Ohio. And then we're going to discuss the opportunity for Ohio's prevention workforce to provide more inclusive prevention services. Just recognizing that as our knowledge base grows, so do our services, so do our plannings, and so do our strategies within prevention. So I am going to stop sharing here quickly, and I'm going to hand it over to Julia, our presenter, and we'll get it kicked off.
Okay. Hello. I want to make sure that everybody can see my screen. Can you all see my presentation on my second screen there? Yes, perfect. Great. It is always a fun moment when you're like, is this going to work today? But it is. We are in luck. So as Tessa mentioned, my name is Julia Donovan, and I am the program director for OhioKAN, which stands for the Ohio Kinship and Adoption Navigator Program. I also oversee the Youth Navigator Network, which we'll talk just a little bit about sort of on our journey today. And if you, my good friends, are not familiar with Kinship, never fear, I'll sort of take you through kinship caregiving, as well as some resources for kinship families and caregivers, as well as adoptive parents, and as well as youth that are aging out of foster care or have been in the child welfare system. I also am open to questions along the way. Some of them you can ask out loud if you choose, or you can put them in the chat. Either way is fine with me, but I know we also have some opportunity for you guys to have some great discussion amongst yourselves as well. So that is okay too. I will go ahead and get started with getting to know our statewide program here at OhioKAN. This is our team. This is sort of our statewide team. We are a program of DCY, so the Department of Children and Youth. And so we have Veronica Burrows, who is our wonderful project manager and support person over at DCY. And then we have a statewide team that sort of helps support the program with sort of program management, training, benefits, sort of those pieces. So a tiny snapshot of sort of the folks who work across the state. And like I mentioned, some of you may be wondering to yourselves, like, what is kinship? And we have this great quote from one of our grandmothers. We try to work really closely with folks with lived expertise or lived experience. We have a wonderful set of caregivers, parents, families, young people who work with us to make sure that we are centering them at the core of our services. And so we think of them as advisory groups or focus groups, co-designers, lots of different ways throughout OhioKAN's history that we've sort of brought in those folks with lived expertise into the fold. And this is from Lillian, who is a grandmother. And she said, they told me I was eligible for help as a kinship caregiver. And I smiled and I thought I was grandma, right? What we know is that kinship is not always sort of a common term that folks are familiar with. And kinship can be defined in a lot of different ways. So for us here at OhioKAN, kinship, it refers to that relationship between people who may be related by blood, adoption, And it can even be chosen family. So we think about chosen family as those neighbors, family, friends, people who are in your network that are important to you and sort of chosen as part of your family support network. And there's a wide range of connections that can fall into kinship. So sometimes people think of kinship as only being blood relatives, and our definition is just a little bit more expansive than that. One thing I always like to mention, and we'll sort of talk about how many folks in Ohio are living in a kinship situation, but they're us and we are them. So what this means is that it's very, very likely that you in your either immediate circle, you yourself, or somebody that you love and care about has been in a kinship caregiving relationship to a child or young person. So it's actually pretty quite common, but wanted to sort of share that definition with all of you. I have sort of sprinkled throughout this presentation what I'm calling inclusion tips. So these are just areas of when you're thinking about kinship and working with kinship caregivers or young people in sort of your respective fields, just things that we just want to remind folks of and we sort of elevate as best practices for us or reminders for us on our side. And a lot of these have been informed by those folks with lived expertise and lived experience. So we just want to acknowledge that there are very few people who are going to walk into your door or to your services or approach you and say, I am a kinship caregiver, right? That is not something that we typically see. They're more likely to say, hey, I'm taking care of my granddaughter while their parents are away. What do I need to do to help get them enrolled in school, right? So sort of listening to those cues and also recognizing that not everybody is familiar with that term kinship. So we like to elevate that and sort of listen for cues that somebody may be caring for a kiddo in one of these different types of situations. Okay, the benefits of kinship care. So this is really important. Uh, as part of what we would consider a kin first culture. So here at Connect and at OhioKAN, we want to make sure that young people and children are staying with kin. We do this because we know that it's more stable for children and young people when they're in a familiar environment, right? I think that just naturally makes sense to many of us that it's easier, to be with somebody you know as a young person than somebody you don't. This next one is incredibly important to us as well, sort of that cultural continuity. We all have different cultural bases, different religious bases, different community supports. And it's really important that a child maintains those cultural identities and that cultural continuum, which is another reason why being with kin is really important. And we also know that staying with kin reduces trauma. So if a child or young person does need to be removed from the home, or their parents are no longer able to care for them, or their parents pass away, it is far more supportive of that young person and trauma informed to be with known folks, right? And we know that their outcomes are better, right? We know that outcomes for kids who are growing up in foster care or congregate care are not nearly as good as those who are living in a kinship situation. So we want to make sure that we're helping with those family connections as well as their sort of their well-being. One of the jokes I make is I'm 44 years old and I still need my family, right? I still need their support and their help. And that is an important aspect, I think, of all of our lives that is shared. Here's another little inclusion tip here for us today. And this is really coming from sort of those voices of lived expertise and experiences. They really want the community to know and understand that kinship is not a problem to be resolved by schools or communities. It's a kindness and a gift by caregivers who step up for children and parents that need support. And it should be acknowledged and honored as such. So we just really hold this sort of close to our hearts in the sense that we want to make sure that um, we're not looking at it as a systemic problem, but as a way to support and honor those who are stepped up to be a meaningful person in a young person's life. So a really important piece here. And when we're also thinking about this, there's a couple of ways too that we can also be really thoughtful about how we include caregivers. So if you happen to know that somebody is caring for a young person or a child, just a couple examples that we've seen in the community. We've seen YMCA's offer discount family rates for those who are in kinship situations so that they can have a place of respite, perhaps. As many of you know, some YMCA's offer childcare so that the caregiver can, swim in the pool or go in the sauna or, do some of those things and get that discount. Another thing that we've seen is schools who become aware of kinship situations or sort of a new guardian relationship will give free tickets to that caregiver to the upcoming sporting event so that caregiver can sort of become part of that community and not feel as alienated or isolated, and they can sort of feel that welcoming embrace of the community. So just a couple of examples there to think about as you're thinking about your own respective places and spaces, and how can you show that kindness to your community, and how we can support these kinship caregivers. Also, with that being said, patience. We sometimes, I mean this in the nicest possible way about myself, but we can get sort of stuck in a rut of this is the process and this is the procedure, and that anything outside of that can feel overwhelming. And what we ask is, OhioKAN, and we'll talk about this more in a moment, is we really try to be flexible and responsive to what families need. And what's important is that this group of people has very specific, unique needs. So one of the things I will say is that if a child and young person is not being cared for by their biological parent, something bad has happened, right? There isn't a situation that I'm aware of where something bad hasn't happened to for that child or young person to be in kinship care. And so we want to honor that and hold that it's probably been pretty challenging on everybody involved, including the caregiver. Sometimes it might be you get a call today that says, hey, I'm calling from child welfare. This child needs to be removed. Can you take them in? Right. And so it can be just like that in a snap where you're a caregiver and you weren't prepared. You don't have childcare. It can be a very, very overwhelming time for both caregivers and young people and children. So just when you're hearing if people are requesting some additional supports or things that they need, just be really thoughtful and thinking about, what are some of the trauma triggers that this may be having for families, and how do we support that, and how do we think about being an advocate for what that young person needs. The need is great. So here in Ohio, we believe we have about 239,000 families that fall into the category of being raised by a non-biological parent. Okay, so this includes adoptive kiddos, as well as those in kinship care. I will let you know that nationally, it's estimated at 2.5 million. So we are not talking about sort of a small portion of the population. We're talking about quite a large group of people.
Absolutely. And I just want to hop in. I heard the
Yeah.
background noise and I was muting, and then it just dawned on me afterwards. Someone may have been jumping in with a question. So I want to
Ah,
apologize off of the bat here and say, I'm so sorry. But if you have a question, feel free to jump in live and I won't mute you again. I'm so sorry about that.
yes, and I will pause for a moment. Thank you, Tessa. Okay. If you do have questions, again, I love good questions, so don't hesitate. So OhioKAN, so you might be asking yourself, what is the Ohio Kinship and Adoption Navigator Program? It's a flexible and responsive program designed to assist children, caregivers, families, young people, and it can be anything from a really simple question to a complex challenge. We want to be sort of that go-to place for kinship and adoptive caregivers statewide. And the ways that we do this, is by supporting both informal and formal families. So we're going to have like a little timeout to nerd out on definitions here. So we know our definition of a formal family is anybody who's had child welfare involvement. So there are a number of cases across the state where child welfare has been involved in that removal of that child from that home and their biological parents. But there are lots and lots and lots of informal families as well. So an informal family is a family who has not, where child welfare has not facilitated that kinship relationship. So it might be a family who is struggling with a child who has addiction, right? It could be that they have decided to take in their grandchildren as their child attends rehab, right? Um, there are a lot of different situations and why folks are in kinship care, but many of them are informal. And kinship also, just to sort of expand on some of these definitions, can be anything from temporary to permanent. So it can be short-term, long-term, and sort of everything in between. Okay, so one of the core tenets of OhioKAN that you'll hear us say all the time is that we believe families are inherently capable of finding solutions to the circumstances and challenges they face. So simply put, we believe families. So we really try to center empathy in the work that we do, and our empathy is around believing families' experiences, believing caregivers' experience, believing young people's experience. And if we can start from that place whenever we're working with a family, we get to a better outcome because we are being directed and guided by that family. And we're recognizing that that family has a lot of value and strengths in this process. So that's just a really important sort of grounding tenet of how we think about our work. We also have a very specific inclusion, diversity, equity, and access framework. If you have questions about this particular framework, I can talk about it all day and nerd out. Feel free to reach out after if you have additional questions about how we've incorporated this. But one of the areas I want to talk about briefly is that we have done a culturally responsive and equitable evaluation, which means we've taken measures to validate from a diverse group of caregivers what matters to them and how we're thinking about the work with kinship caregivers. So this is not something many programs do and a really important aspect of our work. We work incredibly hard to maintain equity across the state and to provide access to all families, regardless if they've been marginalized by a system. So that includes LGBTQ plus, sort of affirming caregiving as well as Black and Brown families, multiracial families, Latino, Latinx, just really trying to make sure that we're being explicit, inclusive, sort of all people who may enter a kinship situation. Honoring dignity. So when we think about, this like little inclusion tip here, we always want to make sure that we are maintaining folks' dignity. And one of the ways that we can do this is that we want to make sure whenever you're sort of sensing, like remember our inclusion tip of listening, like you've sort of heard that there's a unique relationship here. We ask that you just sort of pull that caregiver aside and ask further questions there, perhaps not in front of that child because it can be very confusing for that child. And we also want to make sure that we're protecting the sensitive details around that situation, depending on what your role is. And we also want to make sure that we're always speaking really respectfully of parents because we don't want to, we want to avoid any loyalty conflicts, right? So again, the reasons that children are not with their biological parents are typically not good, but that doesn't mean their parents are bad, right? It means that there's an issue that they're struggling with. And so we just really want to make sure that we're holding out hope and space for that child to still have a relationship with that biological parent. Kinship is not an attempt to sever relationships. It's an opportunity to increase support and bandwidth for families that are in struggle. So what do we offer caregivers? So we have dedicated navigators across the state. and they're there to engage with families, work with them through their sort of exact situation, and again, be that flexible and responsive. So we have a hotline that you can call. It's not technically a hotline. I shouldn't say that. It's just a call line, if you will, where folks can call in. Across the state, you get a live person. I would say 90% of the time. On the first time you call, you get a live human, which is great. And we have an information hub, and actually this picture is the information hub that we put in this little laptop symbol here. But we have curated with some partners at the Human Services Research Institute, and they are out of the state of Oregon, but they have helped us map. We're almost up to 10,000 resources in the state of Ohio. So we have a very, very robust information hub that we utilize to search and find resources for people and their families. And we also offer sort of a continuum of support. So maybe you're calling, you just want an information or referral, and you just need to know if there's a place to buy reduced sort of uniforms for your kiddo entering school, and you're looking for, you know, a uniform exchange program, or, you know, something as specific as that, to, I don't know how to access Ohio Works First benefits, right? And it could be very complicated as even helping you apply for some of those benefits that kinship caregivers may be eligible for. We don't have enough time for me to tell you all about those benefits, but there are a number of benefits that we can help folks navigate through the system, including Social Security and Disability, SSI and SSDI. So a number of ways that we can help support families and caregivers. Some of the like kind of concrete and explicit ways that we can help is we can directly connect them to community resources. So we will make the call on their behalf and connect them directly. So if a family doesn't have time to call 5 places of resources for, let's say, food banks in their area and double check their hours, we can do that for you. We can also get on the line and call on your behalf and patch you in. So we can say, hey, do you want to call the Ohio Department of Job and Family Services together? We can call your Ohio Works First worker together. We can figure out how to get this resolved for you, and we can do that together. We also work very closely with Care Portal. Not sure how many of you are familiar with Care Portal, but Care Portal is a network of community organizations and churches that offer sort of support for families and caregivers. So we work directly with them to connect families directly in their local communities with folks willing to support. Again, we have benefits, consultation, and coordination. So anything, again, from Ohio Works First to again, that SSI, SSDI, and everything in between and along the way. And we have a couple of benefits coordinators that can directly help families with that. And we also are working alongside a DCY, so Department of Children and Youth, making sure that if it's a formal situation and there's a caseworker involved, that we're working hand in hand to make sure that family, that kinship caregivers, are getting the supports that they need, and we're working together to help them access any benefits that they may be eligible for. And the last thing is access to flex funds. So we do have a specific pool of funds that is used as sort of a last resort for kinship caregivers. So some of the really common areas, I sort of mentioned at the beginning that you might get a call today that you are caring for a kiddo and you need childcare. As we know, childcare is very expensive. If I had to take in 2 or 3 kids today, I would also struggle to pay for those childcare costs because it's not a part of my daily, it wasn't a part of my budget, right? And so we can offer sort of immediate relief and cover, you know, let's say up to 3 months of childcare for those kiddos that are in your home, and different things like that. So we can help with sort of housing supports. Maybe you need to move because where you are now, it, you know, isn't going to work. Maybe the kiddos have disability specific needs and you need modifications to your house, right? We can help you work through those resources and help support some of those pieces and parts. So those are just a couple of examples of things that we've helped with in the past. Again, we're trying to be the group of last resort. I promise you, we don't have enough money to help all the needs, but we do try to help and support where we can. And again, those are just a few examples of some of the things that we have done. I'm sure the list, kind of goes on and on. We are a statewide program, so we serve all 88 counties, and we have served families from all 88 counties, which is really exciting. And we operate in 10 regions. So one of the things that's really important to OhioKAN, and when the state was sort of imagining what OhioKAN could be, is to have a statewide program so you have that consistency, right? We want to make sure that no matter if you're in an urban area or a metro or someplace in between, right? That you have the same access to supports. And so we broke the state into 10 separate regions, and we really have those regions focus on those regionalized local supports. And we also partner with a wide variety of agencies in different areas, from everything from areas on aging to departments of developmental disabilities to recovery centers. We recognize and acknowledge that kinship touches a lot of different facets of communities and of people's lives. And we want to bring all those partners on board with us. So our navigators actually sit at those community resource organizations to bring in that additional expertise. So we really value those partnerships and think they're really important to sort of have that local again, just that expertise. I sit in Cleveland. That's where I'm sitting today. And I promise you, I don't know all the things that happen in Meigs County in Southern Ohio, right? So just making sure that we've got those sort of folks that are there in those communities and who understand the resources that are available to families.
Absolutely. Thank you so much for sharing. And I did want to draw your attention to, we had a question in
Oh,
the chat.
sure. Yes, lovely.
Just in
Thank you.
case, because I know when we're presenting, sometimes like a presentation mode doesn't let you see the chat
I cannot
accurately.
see the chat, so that's cool.
Yes.
So thank you.
From Lakin, is this for temporary placements, or can kin that end up with permanent custody utilize these services?
Ooh, such a great question. Yes, everybody. Your guardianship status doesn't matter. So as long as you are caring for the kiddo 51% of the time, and that's very specific. So we may also have bio parents that are living in the home, but they're not the primary caregiver. So think about those who are in recovery or struggling with addiction, right? There may be caregivers there may be bio families in the home, but they're not actually the primary caregiver. So they are also eligible for OhioKAN services. So custody status does not matter. So it could be, again, a temporary situation or a permanent custody situation. And again, that also leads to sort of adoptive families who also qualify. So anybody who's post-adoptive qualify for our services in perpetuity. The nice thing about OhioKAN is our services, you're always welcome to come back. So you can come back, and actually we've been around for about 4.5 years, and we see at this point about an 11% return rate from families that maybe their needs changed, right? Maybe there now is an identified disability for that young person, and they need supports with the IEP process, right? And they come back and say, hey, what resources do you have? They'll come back to us and say, hey, my kiddo is struggling with the 3rd grade reading test. Do you have resources for tutoring, right? So needs of families and caregivers change, and so we try to be really responsive to that, which is why we don't put parameters around eligibility. So again, it's actually quite unique that we serve informal and formal, and that custody type doesn't matter. So you don't actually have to prove to us what your custody relationship is with that young person. So hopefully that helps. Okay, I think we're good. But keep the questions coming. Again, I love to answer them. Just as a quick aside, as we're sort of moving through these slides, we are an evidence-based program. We have submitted to the Title IV clearinghouse, and we have been sort of blessed with these 5 areas where caregivers have found value in our services. So we are hoping to get a positive review to bring in more dollars into Ohio for kinship programs. So that's a very exciting piece. I want to sort of move us through, like, who are the people that we're serving? So we have 14% are post-adoptive, 30% are that informal group, and 58% are formal kinship. This is our demographics. So as you can see, most of our caregivers are between 50 and 60 years old. I do just want to say in my out loud voice, this is like a really pretty nice bell curve, but we do have folks on those outliers. So we actually have 4 caregivers who are under the age of 18, caring for a non-biological child, and we have 4 people who are over 90. So you think about sort of the complexities of serving folks in that wide breadth and scope of kinship caregiving relationships, and that's why we want to have an open door policy. And as needs change and as people have different needs, they can come to us. 50% of our folks are grandparents. And so I just have a little sort of disclaimer here for us to think about is that when we think about 50% being grandparents, there's a likelihood that there's some generational differences, right? That might be an overgeneralization, but you think about school, technology, many of these things can be challenging. So just keeping in mind, that we have a separated generation, and there can be difficulties in just understanding each other because of that. But again, just a wide variety of different relationships that we're seeing from our caregivers. Matching language. So here's another inclusion tip. We want to really make sure that we're listening for terms that the families use. So if the parent is incarcerated, we want to make sure that we're not using that language when the family says mom's away, right? We want to make sure that we're matching the language of the caregivers and the children. If the child calls them Margie Mom, you call them Margie Mom, right? So sort of matching and taking the cues from those caregivers and families to make sure that you're aligning with the unique situation of kinship. What if families want help with? So big deal here, basic needs and financial resources. 72% of our families, so this is all OhioKAN data, which is really exciting to be able to share, but caregiver social groups, child health, child care, legal resources, and caregiver training. We are actually about to launch a legal pilot to help in Southwest Ohio to try to make sure that we can help families that have needs in those areas. We also have 2 support groups, one for adoptive families and one for kinship families that run statewide. One is Kinship Caregivers Connect, and the other one is Encompass Adoptees. And we have sort of sponsored those programs across the state because it was the second most important thing that caregivers needed, is they wanted to talk to other caregivers who'd been in similar situations, because it can be very isolating, right? Some of your friends may be in retirement, if we're thinking about grandparents, and you're back to caregiving of young children, right? Very different place in life. And that those social supports and caregiver connections are really incredibly important. Wanted to just give a shout out to PASS. So PASS, you might not be aware of, is the Post-Adoption Special Services Subsidy. This is a subsidy that's available to adoptive families year after year whose young people have sort of disability, mental health, or emotional needs that families needs financial support with. So in this program, you can get up to $15,000 a year for support to make sure that that young person is supported with all their needs being met. So I want to give a shout out to that. We also have the OhioKAN, not only OhioKAN, but the Youth Navigator Network. So we do serve and support through this program young people aging out of foster care. So very similar services to OhioKAN. So either aging out or a young person who's in out of home setting that have had a case with child welfare within the last 24 months or 2 years. So a program specifically geared towards youth and making sure that we're meeting their needs directly as well. These are our contact information. We always love to share how you can contact us, either at OhioKAN or YNN. YNN, just like thinking about those generational pieces, OhioKAN, we have no problems getting phone calls from people. We get about 600, 700 calls a month. But the Youth Navigator Network, guess what? Those young people text us. So we get lots of texts from young people, and that's the predominant way that they reach out to us, or web inquiries. So we did make a specific texting line for those young people as well, and I found that to be really successful and how we reach out. These are QR codes, so if you are looking for any resources that you would like from OhioKAN or Youth Navigator Network, these are exactly the bifolds that we have for you. We have other resources as well. We have, posters, rec cards, sort of the whole gamut. So if you are looking for materials that you would like to share, we are happy to send them directly to you. And you can do that by using those QR codes. And I'm happy to share the presentation. I probably didn't mention that, but I can send out through Tessa for all of you so that you don't have to feverishly write these down.
Thank you. I appreciate that. You addressed that question before it came up. I didn't want to speak for your materials.
Yeah, sure.
And I did
And
hear
then
someone
just
come
our
off mute.
last,
So
yeah, of course. This is sort of our last slide of, sort of our contact information. So I will go ahead and stop sharing and open the floor if there's any other questions.
Could I ask a question?
Of course.
Hi, I'm Vicki William, and I work in the Caregiver Support Program at the Area Agency on Aging District 7.
Mm-hmm.
And could you explain that task again to me, please?
PASS?
Did you say task or PASS?
PASS, the post, I think what you're asking about is the Post-Adoption Special Services Subsidy. Does that sound familiar? Yeah, so PASS is the family has to provide information from a doctor or medical professional indicating that the young person has, let's say, a speech therapy need. And the family's insurance doesn't cover the speech therapy cost, or there's a copay. The family, this is specifically for adoptive young people and children who have been adopted. They can then apply to the state to get funding to pay for that speech therapy. It also covers residential. So if there's a mental health need or a mental health crisis and that young person needs residential treatment, it will cover, portions of that residential. And it'll cover, again, sort of therapy sessions, physical therapy, anything that really can be identified by a doctor that those young people or children need. So I hope that helps.
Okay. And yes. And how does someone get in contact with them?
Yeah, you just call us at OhioKAN.
Okay.
And we can start the process. So we actually administer that program on behalf of the state of Ohio.
Okay. Well, thank you so much.
Sure.
Wonderful. Thank you very much. As is a true prevention exchange sort of style, we're going to break you guys up into some breakout rooms, but we do have a couple of discussion questions for you today. So we want you to consider together, how does your work overlap with kinship care, and how is the information presented impact how you consider kinship care needs, or how you will approach offering support in the future. So I am going to go ahead and open up breakout rooms right now. You are assigned automatically. So it's just going to be, shaking up the room and kind of dividing you guys up. So what you should see right now are breakout rooms opening. So if you have not seen a pop-up come for you, it should be on your bottom ribbon. You should see like a red one or some other sort of notification. If you have trouble getting into a breakout room, you can stay in the room and we'll help assign you to one and make sure you get in your space, or type in the chat or unmute, whatever is easiest for you. I see folks are kind of moving. Let's see, a couple folks. So Nina, Alicia, Anthony. Well, we've just got Alicia and Anthony. How are you guys doing? Do you need some help finding your breakout room?
Hi, Tessa. I know I would love to jump on them. It was a great presentation. I'm gonna have to jump off, but thank you so much.
Thanks for joining us. We really appreciate it.
No problem. Thank you.
Good to virtually see you.
I know. I need to be seen more. Look, this is me. I'm trying to get ready for summer camp. And this is what I'm like, okay. Then I have to work tonight. So I can't.
Everyone, welcome back. We should see some folks kind of starting to trickle back in. let's go ahead. It looks like room 1 is still going strong. So they are, I see those mics lighting up. So we'll give folks another 30 seconds to join us. Thank you. And as we come back together, I have a few slides to kind of take us home. But Julie, before I start my share on those, I just wanted to, or Julia, I want to see if you had anything that you wanted to share, if you wanted to share your contact slide or anything like that.
I can. Yeah, I would be happy to share my contact slide as we're sort of hanging out here at the end, so that people can utilize that. That's not a problem. Again, I love questions, so if you would like to talk about any of the things that I've shared, I love to talk about them.
Wonderful. So we'd love to hear while you may be writing down Julia's contact information. I would love to hear from you kind of what was the consensus of your breakout room? Were there any aha moments or anything that really connected for you today? I'd just love to hear from you a little bit before we share the evaluation link.
One thing that we discussed in our group was that when you had mentioned right towards the end about families that engage in kinship care, but maybe not on an official level, right? That families supporting families kind of thing. And we got into a discussion about support systems or what is available even as a resource for those situations that don't have an official children's services involvement or, that type of thing. And it led to some pretty good discussion about, is there something like that out there that people could access easily? Because we find in our official capacities, the three of us found that that it ends up being that people call children's services because they don't know. And so they end up providing the resources that they can, but it still goes kind of down that official path that sometimes people are wary of, especially if they're trying to, make things work within the family.
Yeah, so that's a great question, Emily. I'm going to be very transparent and tell you straight up, there are far less resources for informal families. Which is why I sort of mentioned that it's rare actually that a statewide program is offering supports to informal families. It's very typically geared towards that formal involvement folks. With that being said, there are a couple of areas worth exploration in your area. So sometimes the areas on aging have resources for kinship caregivers, regardless of if they're formal or informal. And every kiddo would qualify, almost every kiddo, I should say, would qualify for OWF, Ohio Works First, because it's child only for that particular benefit. So that's not 100% true all of the time, but for the most part, that is a benefit that they can all access. And there are scenarios in which, there are programs and benefits where if you become involved with the child welfare system, you can become a licensed foster care parent as a kinship caregiver. And so, but that would require you, like you said, Emily, to sort of enter the system to then come back out of the system. So I hear you when you sort of say that, not everybody is comfortable with that process, and just want to accept, elevate and affirm that your teams and your breakout rooms assumptions are correct, that the services available to informal families is far less. Again, which is one of the reasons we have OhioKAN to try to fill in some of those gaps and try to find resources and supports where we can. Good question. We did have a question in the chat that I wanted to get. Ella, are you still here? I can't quite see everybody, but you had asked, are the grandparents 50%? What is the percentage of them being AA? And I would like a little clarification on what you mean by AA. Are you asking African American? Are you asking an Alcoholic Anonymous? Are you asking area and aging? Okay.
Well, no, African American.
Okay, great.
What is the percentage of them being African American that's serving as part of that 50%?
Yep, it's 31%. So I did check our dashboard while you guys were in your breakout rooms to answer that question. So it's 31%.
Thank you.
You're welcome.
Is that 31% of your total population or 31% of that 50%?
It's 31%. Thank you, Tessa. It's 31% of our total population. So we don't break it down. We actually do, but I can't do it fast enough. How's that?
Oh,
so
yeah.
I have to do I have to do more toggling to get you fully to that point. And I didn't have quite enough time to do that in our dashboard.
No,
but
you're
yes,
totally
thank
fine.
you. Thank you for clarifying, Tessa. Yeah, it's 31% of the population, and 4% of our population identifies as mixed race.
Thank you. I appreciate you clarifying because I know, you know, sometimes when we're just exchanging information quickly, especially a question on the fly like that, when it's not on a slide, I always try to just to make sure I understand more deeply. So Julia, I really want to thank you for your time that you shared with us today and all of your expertise and just your work for Ohio. It has been so inspiring to learn from you in our discussions. I really value the time that you have spent with me in preparation, as well as your time spent with us today. It was just a real pleasure to get to learn from you. I want to hold some space just in case folks have a couple of last minute questions. I think we have time for like one more question. While you are kind of framing your thoughts there, I am going to go ahead and do it a little different today. So instead of sharing the slide, I'm going to go ahead and put the link in the chat for the evaluation, just so we can hear from you. You know, did you like our, again, updated format? Is there anything you want us to change? But also, I'm going to stop talking just for a moment just to let folks get that last question in. If there are no questions, I really want to thank everyone for spending your time with us today. We'll let you fill out that evaluation. We will pause the recording or stop the recording now. Just want to say thank you so much, Julia. We really appreciated your time and energy.
I enjoyed sharing. And again, don't hesitate to reach out with any questions that you